Hi friends, this is your friend Dr. Sujata Naik from Mumbai. In your own channel, Dr. Sujata's Homeo Insights. And if you recollect in the introductory video, I had mentioned that we will take up clinical conditions and the homeopathic applications to the same. So today we are going to discuss about acute bronchitis. So in short, a little bit of definition, a bit of the symptoms, and then we go on to the homeopathic applications. So acute bronchitis is inflammation of the bronchial tract, of the respiratory tract, and resulting in cough, wheezing, and breathlessness. And because it is acute and more often in children, it is often associated with fever as well. The common remedy, the common symptoms, of course, we know is that fever, cough generally starts with a dry cough, which later on goes on to become a very deep and a very productive cough, sometimes unproductive with very little expectoration, often associated with wheezing and breathlessness. So these are the symptoms, and the onset is so acute that we have very little time to act on. And most of these conditions will go to the allopathic doctors where inhalers and bronchodilators and antibiotics are prescribed. But if the patient approaches the homeopath and if we can work on the patient immediately and can give relief within the first 12 hours, so give the patient symptomatic relief, because most of these conditions are viral conditions and they're going to take their own time to completely reverse. But if we can see the patient through symptomatically, allowing nature to take its course, I think we can abort the infection and also avoid excess use of antibiotics. So the remedies generally that are indicated in acute bronchitis are aconite, and you have belladonna, you have carboveg, arsenic album, ipecac, antimtat, you have sulfur, lycopodium, pulsatilla, amon carb, natrum sulph, lycopodium, as I said. Nux vomica is one of the very good remedies. Calcarea carb and kali carb. So these are the commonly used remedies in acute bronchitis. And we'll quickly run through the conditions, because what is very important in an acute condition is quick thinking and quick prescribing. And because most of these conditions are, patients are going to come with very common symptoms, so you're not going to really have a constitutional picture there. But even in such a situation, there is no need to prescribe only specifics. You can prescribe a remedy with a very individualistic approach by using some specific keynotes, characteristic keynotes. So for example, if the patient is aconite, it's going to be a dry suffocative cough, very acute onset, and there is a dryness of all the mucous membranes in aconite and a very suddenness of the onset. And often the first few doses of aconite can actually stop this from happening. Belladonna, of course, the cough is very congestive, the patient's face is very red, and you can see that the cough is very suffocative. So belladonna often helps in these conditions. Ourselves, as we know, is that the cough is always at night, associated with wheezing. Patient is unable to lie down, unable to sleep, and there's a general distress in the patient of arsenic album. It is unlikely that calmness and arsal will go together. So the patient is very restless, sometimes very fearful, afraid that he's going to choke to death. So arsal is one of the remedies indicated at that time. Although it's also, because it's a very good polycrest, indicated in all stages of bronchitis. Even in acute stage, if the patient presents with these symptoms, you can safely give arsal. You have kali carb, again with cough which is deep and expectorant. There's a lot of expectoration, but the patient feels typically breathless around early morning. So it's between 3 and 5 a.m. that you'll find the maximum aggravation of kali carb. Pulsatilla is another remedy which has cough associated with breathlessness and wheezing, but typically at night the child is not going to be able to sleep. Whenever he lies down, he's going to have bouts of cough, and he'll want to either switch on the fan or want to go to the window for some fresh open air. So this is what is pulsatilla about. Antimtat, we all know, is the king of bronchitis, always helps. It is one remedy which generally does not fail. But you should also remember that the cough is very suffocative. You can actually hear the child wheeze. The patient cannot lie down, and rattling a cough. The child wants to expectorate but cannot, and that's where antimtat generally helps. Ipecac is another remedy which goes very close over here. Here the child is going to be coughing through the night, and it's so bad, the cough, that the moment the child vomits, there is instant relief, and ipecac is always better by vomiting. The cough is always better by vomiting. So this is something which is very good. Lycopodium is another very good remedy for acute bronchitis, often underused. But you can see that in lycopodium, generally towards evening, the child is going to get worse after 4, 5, 6 p.m. The child goes down to play, he comes back, he has his glass of milk, and that's when all the problems start. And here lycopodium can be given as an acute remedy, though I would still consider it as a subacute or a chronic remedy, but you can give lycopodium in acute. Nux vomica is a very surprise drug in acute bronchitis. You'd always think of it in gastritis and GI ailments or anything to do with the digestive tract. Here also, although we are using it in respiratory complaint in acute bronchitis, always there has to be some element associated with the digestive system. So after eating out, or if a patient has on a full stomach, if the patient complains of a lot of, he says that after eating I have a cough, or after eating I get breathless, that's where you can think of nux vomica. So these are the common remedies. Again, Cilicia is one more remedy, although it is again the subacute to chronic, but in a cough which is very deep and where the patient has very thick yellow expectoration in the suppurative stage. And so this again becomes subacute, not really absolutely acute. Natrum sulph is one remedy you can always give at the onset of bronchitis. In fact, we've used it as a genus epidemicus in several seasonal epidemics, and it is something when there is a humid kind of weather just at the onset of monsoon. The monsoon has not really set in, but there's a lot of humidity. Patients feel suffocated, says that I wish it starts raining so I'm going to start feeling better. That's when natrum sulph is going to really help. Lachesis is another remedy again for acute bronchitis, but it has to be really indicated for you to give. And most of the adult asthmatics might respond to lachesis if they say that I always wake up with wheezing. I'm okay until I go to sleep. After I go to sleep, that's when all the problems start. So lachesis always sleeps into aggravation. They cannot bear any kind of clothing around their neck, a necktie or a scarf, or even a bed cover which covers their neck is something they're absolutely averse to. They're quite hot also. Another hot remedy is sulfur, because sulfur also has breathlessness with cough, and they always have burning, and they want cool. They want the atmosphere to be cool. Even in the stage of acute bronchitis, they will want the fan to be on. Even with the fever, they will want the AC to be on. So these are some of the common remedies you can always think of. Homeopathy can really play a vital role in acutes, and we have got wonderful results in all stages of bronchitis with homeopathic remedies. It's just that you need the confidence and you need the knowledge to apply them. So bye for now, and ciao. See you next for the next episode.